Hello, my name is Sean Wimberley. I'm a second-year medical student with the Florida State University College of Medicine. This past summer, I worked on research with Dr. Stephen Quintero at FSU Primary Health. And what we did was we looked at factors contributing to missed appointments in an underserved primary care setting and mitigation opportunities. So a little background information. The reason I was interested in this was because in my research, up to $78 billion is lost annually in the United States healthcare through failure of coordination of care. This results, as many of you would know, in unnecessary emergency department visits, hospital admissions, readmissions, and other avoidable complications. This also leads to a decline in functional status and increased dependency for the chronically ill. And in primary care, we are the gatekeepers to a lot of other services provided to these patients. And so when you have a disconnect in primary care, then many of these patients don't have access to a lot of the services that they need. Now, according to a 2022 study, it looked at whether switching patients to telemedicine during the times of COVID decreased racial disparities in postpartum hypertension follow-up adherence. And they looked specifically at African American patients and their follow-up percentages pre and post telehealth. And what they found was that the attendance changed from 48.5% to 76.3% among African American patients versus 73.1% to 76.7% among Caucasian patients, leaving only a 0.4% racial gap and thus eliminating racial disparities. So the purpose of this research was to identify the most common reasons for patients who were unable to attend their primary care appointments. And the secondary outcome was to identify a potential method of delivering care via telemedicine. So this was a combined 10-week prospective and retrospective study focused on the underserved population at FSU Primary Health. The inclusion criteria were consenting adult patients of the study provider and were clinic patients of FSU Primary Health. They were also included if they missed, no-showed, or rescheduled a confirmed appointment within the past 6 months, and this range was from December 2021 to June 2022. The exclusion criteria were patients who were under the age of 18, if they had not missed, no-showed, or rescheduled a confirmed appointment within the past 6 months, and if they were not patients of the study provider and study clinic. So this is just an example of interview questions that I asked the patients. So when these patients did not attend their appointments, their information was forwarded to me, and then I would call the patients and just ask them, first of all, were they willing to participate in the study? I would explain what was going on in the study, and then once I received their consent, we would move along with the questions. So I'd ask them in general, how many appointments have you missed within the past 6 months? How many within the past year? How do you believe missing appointments has affected you in achieving your health goals? Please tell me what obstacles you have in attending your appointments at FSU Primary Health. I also asked regarding transportation, insurance status, and appointment reminders, as well as their support system. So I really tried to delve into what exactly was preventing these patients from attending their appointments. As far as the secondary outcome, I asked the patients what have they heard regarding the use of telemedicine, and then I would provide a brief definition of telemedicine, the practice of medicine using technology to deliver care at a distance. I would ask them, do they have access to a functioning device? Do you have reliable internet or cell phone connection? And then after learning what telehealth is, would you use this type of service if deemed appropriate by your physician? So again, these patients were of FSU Primary Health. And when FSU Primary Health was established in 2018, they were specifically placed within the poorest region of not only Tallahassee, but within Florida. They're just across the street from the poorest zip code in Florida. And when comparing what is around the clinic versus the rest of Tallahassee, 62% of the patients are of African American descent. 7% are Hispanic, and the per capita income around the clinic is about $12,000 versus around $24,000 for the rest of Tallahassee. So upon looking at the patients, 55 out of 64 patients who are identified for study participation were successfully contacted and agreed to participate in the primary outcome of the study survey. So barriers to attending appointments were transportation issues at 44%, other issues at 31%, work-related issues, and family issues. The reasons listed in the other category were 4 patients who forgot, 2 patients had appointment conflicts, 2 were out of town, 2 patients didn't provide a reason why, 1 patient experienced a house fire, 1 patient said the appointment was too far, 1 patient was confined to their home, 1 patient died, and 1 patient needed a mental health day, 1 patient reported a scheduling error, and 1 patient moved. Now regarding telemedicine, it was interesting because of the patients who participated in the survey, 49 patients, or 92% of them, had a functioning device. 44 patients, or 83%, felt that they received adequate appointment reminders from FSU Primary Health. 81% had heard about telemedicine, and 92% had reliable internet and cell phone service and would also like to use telemedicine if that was deemed appropriate by their primary care provider. I also looked at types of insurance, and so this kind of goes along with the same demographics that I expected. 45% had Medicaid, 31% had Medicare, 9% were uninsured, and then 15% had private insurance. And then this is just showing more of the breakdown of the demographics of the study participants. So 69% were African American, 29% were Caucasian, 1% or 1 patient was Hispanic. The average age was 50 with a range of 20 to 85. Most of the patients were female. And I also looked at missed appointments within the 6-month range as well as 12-month range. So for the study participants, the average missed appointment was 3 within 6 months, and then 5 within 12 months. The average distance that these patients lived from FSU Primary Health was about 8 miles. And the reason why I have an asterisk was because there was a couple who traveled throughout the year, and so their actual home listed was 290 miles from Tallahassee, so I did not include them in the average distance calculation. And then one of the last slides, the reason why I put this in here was to provide some humanity as to why we are doing this, and the reason that these patients are not statistics, they are human beings. So I just included these quotes. I live around the corner from FSU Primary. My house burned down. Now I have no place to live. and I have to drive from Crawfordville, which is about 30 miles from Tallahassee. I live in temporary housing. I have to rely on my family and catch 3 to 4 buses to get to the doctor's office. I must make an appointment for transportation 3 days in advance. And then this last patient really affected me. They said, I haven't been able to leave my home since Christmas. This patient in particular lived less than a half mile from FSU Primary, and he was a veteran who was an amputee, and he's wheelchair bound. He had an electronic wheelchair which had been broken since Christmas of earlier that year, and when I spoke to him, it was around June or July, and he said that he still had not, his chair was not fixed, and he had to crawl around his house, and he hasn't been able to leave his house since that time. So as far as my conclusion, missed appointments are an ongoing problem, and as you saw, there are many layers to it. There's not a universal solution that exists to fit all practice settings and populations. Many patients have barriers beyond their control. Patients truly want to attend their appointments, but were not able to be there physically. With the growing accessibility of telemedicine capable devices, this provides a potential solution to the problem of missed appointments. And then, as far as my acknowledgments, I would like to thank Dr. Stephen Quintero for working with me on the summer research project. I'd also like to thank Florida State University College of Medicine for choosing me as a summer research fellow and allowing me to conduct meaningful research